We're getting a question from Jasmine from Edmond, and I'll address this, Dr. Bratzler. Is it true that getting vaccinated if you have already had COVID-19 can reduce long-haul effects? So for people who don't understand what we're talking about, first explain long-haul effects and then talk about the science behind that.
Yeah. So some people who recover from COVID-19 will have symptoms for long periods of time, and it can actually be a fairly lengthy period of time. That particular syndrome has a name now, post-acute sequelae of COVID-19 or PASC syndrome. 50% of people who have had COVID, particularly those people who are symptomatic, may have symptoms that last more than 28 days. The most common symptoms include things like fatigue, body aches, shortness of breath, brain fog or difficulty concentrating, headache, and of course, loss of taste or smell. There are many, many other symptoms, though, that have been described. And so I think it's important to know it's fairly common. There was a survey done of people who've had the long haul syndrome, and they looked at 400 of those patients that then got vaccinated, and 36% of the people in that survey said that their symptoms got better after vaccine. So it's survey observational data only. We don't have a lot of information, but some patients do report that if they've had the long haul symptoms and they get the vaccine, their symptoms are improved.
So what would your suggestion be if somebody's had COVID? Just go ahead and get that vaccine?
Yes, we absolutely recommend that if you've had COVID-19, you should be vaccinated anyway.
Okay.